evening, everyone, and welcome to another edition of Let's Talk About It. This is Susan Johnson, and we have some wonderful guests this evening. And we have Ann Hughes, State Representative Ann Hughes, who is the Vice Chair of the Aging Committee. And we also have State Representative Jane Garraby, and she is the State Representative Chair of the Aging Committee. So I'm going to welcome Ann Hughes to the show, and thank you so much for being with us today.
My delight to join y'all.
Yeah, and Jane's going to be coming in shortly. So let's just talk a little bit about your district, and you're in Essex, and that's one of the reasons you called in.
No, I'm in Easton, Reading, and Weston. I'm in Fairfield, Connecticut. Fairfield County.
Oh, I see. Okay. Okay. Yep. Sorry I messed that up.
Fairfield County.
Jane Garraby. I can hear her, and can I just accept the call and say, hey, Jane, welcome to the show. And I have Matt Rupar out there looking in the parking lot area for you, so you should be good to come on in. Okay, he's going to come here to the back? Yep, come in the back on the sidewalk there. So, yeah, he's out there looking for you.
By the way, for the record, I'm not the vice chair this term. Mary Fortier is, Representative Fortier, but I did chair the working group on elder abuse, neglect, exploitation, and misuse of opioid funds, which is why some of our recommendations coming out of the priority bill discussion include those recommendations.
Okay. Very good.
I propped the door open. There's nobody there.
Oh, Jane, he went out to look. You can't find you out there. Here, I'm gonna give the phone to our producer.
Hi, how are you?
Okay, so that's great. And you and I also share a chairmanship through the Complex Care Committee, which is a subcommittee of the Medical Assistance Policy Oversight Council. So that's another thing that you're doing. And let's talk a little bit about the opioid problem, because that's one of the things I just was at Eastern Connecticut State University discussing. And, you know, how we handle these things, how we've made improvements, but we have a long way to go in terms of addressing the problems of addiction and understanding exactly that it's a neurological issue, it's a psychological issue, it's a biological issue. So it's also something that people find themselves in when they have a real difficulty addressing their basic needs like housing and food.
Yeah, and that's why actually Connecticut News Junkie has put out a really great article about some of the priority bills that we are highlighting in aging. The opioid epidemic has disproportionate impact on elderly, across the country, not just the state, but often because they may be prescribed opioids themselves due to, surgeries or whatnot, and therefore be at risk of being victims of theft or exploitation because they have these in their cabinets or become addicted themselves, but more often secondarily targeted by people who are in the throes of addiction, demanding they're targeted disproportionately for financial scams and exploited because they might own their own homes and end up being homes to family members or other people who have no place else to go because of their addiction. And therefore they lose autonomy over their own housing, over their own space sometimes. Again, it's a secondary but devastating impact of opioid addiction. And we've just seen catastrophic rise in the amount of elderly that are being targeted and scammed and exploited and ultimately abused and neglected as well.
Well, one of the things that I worked several terms on the workers' compensation program, and also I've worked on trying to make sure the insurance industry pays for people who are injured. 80% of the people who are addicted, according to the State Department of Public Health, back when not this term, but back when I got the data, they had said 80% were addicted because the workers' compensation program failed to provide the physical therapy and or the surgery, and they would just give people the medication. They'd get addicted to that, and then once they were addicted to the medication, they maybe became dysfunctional, might
That's
have
right.
to go on Social Security disability, because of the pain and the dysfunction, and then of course the addiction. So, and they may not even make it to Social Security disability because they may have the addiction and just be focused on trying to address that particular need that never needed to happen, if in fact they'd gotten the right coverage in the first place and not had to be made to wait, for all these hearings that they go through. And I won't spend too much time on that, but as you all remember, when Attorney General Tong announced the settlement with respect to the medication, opioid medication, that the
settlement funds, right?
Yeah, the settlement. Who did he have? A young woman there who had got an injury in sports, was put on medication, never treated properly, and became addicted, and it ruined her whole growing up period. She's finally on the path to recovery, but imagine that, because insurance doesn't want to pay, because workers' compensation doesn't want to pay, we have a lot of people who are addicted. And I have to say welcome to our state representative, Jane Garibay. She's in the studio, so thank you so much for being with us today. She's the chairman, of the Aging Committee.
I'm so excited to be here. Hi, Ann. I'm very excited to be here this evening with all of you.
It's wonderful that you're here, and I know that Ann, you're still on the Representative Hughes is still on the Aging Committee. So we're going to have Chairman Garibay tell us a little bit about what's going on the Aging Committee this session, and what should I be co-sponsoring?
You should be co-sponsoring everything.
Yeah, good question.
All right, let's go. Tell me about it.
So we have the Speaker's Bill this year, which is very important because we get to put a lot of good things into that bill, and it's supported. Last year we concentrated on transparency, accountability, and that went a long way of trying to get things in order. To me, there's been a drought. It's been many years of neglect in the aging arena statewide. And we've just gotten a really good team and group of people that together we all understand what's been happening, and we're trying to make change there.
I just want to say thank you for that, and I think we're seeing that in a number of the Human Services Committee areas. Tell us a little bit about the transparency that we want to hear about.
So it's very, very complicated. I was just on another meeting. And so what happens, especially in our nursing homes, so many of them are run by these big out-of-state chains we're finding.
Private equity firms, too.
That's what they are, absolutely. And what they do is they have investors that names aren't out there, and they know they want to invest 5 to 7 years, make 300% on their money, and nursing homes are a target, like apartment dwellings have been in the past in Connecticut. So we have quite a few of these bigger chains in Connecticut, and what we're finding is they know how to hide things that you and I would never think of doing in our normal taxes, right?
Right.
So the nursing homes are sold to a realty company. So let's say they have a chain of 20 in Connecticut. Each one has a realty company underneath them. All right. So then they sell the business of the not the business, but the building, the infrastructure, to this realty company at a very high price. And then what they do is they start charging rent to the actual company of the nursing home. And they just strip them, and they own the auxiliary companies like the landscaping, the food providers, and it's just this big scheme to suck billions out of, which is okay. You know, we live in a free interest, but you take care of your business and you take care of people and you do what you're supposed to do first.
Well, you're not supposed to overdo it with respect to taking the public's money, I don't think.
Right.
I think that's, if they may do it when you go to buy oil, but they shouldn't be doing it when the public good is there, where it's doing health issues. And they're turning it not just nursing facilities. And certainly, I'm glad you mentioned the housing too. It's one of the problems. We have private equity firms buying up our mobile home parks. They're buying up our big apartment buildings. And that's one of the reasons we need those fair rent commissions. It's no longer the small landlord. The small landlord will be.
But they suck them dry without making any repairs, any consideration for the people that live in them. That is the biggest issue.
And that's the problem with the housing. That's the problem with so many of the things where we have the private equity firms. They're not even in the stock market. They've been doing very well as hedge fund with hedge fund managers, and that's how they got to make all this money, and with all the tax credits and tax breaks that they get. And then by dividing up everything into little pieces, it's really hard to follow.
Or the taxes that they owe. If you read the article last week, one of our I think it was CT Mirror or the Examiner, uncovered, because I can't find out if you owe taxes. It's not public information, but it's not public information for businesses either. So what they did was they followed the liens that the towns have put on those nursing homes. And it's close to $1 million in owed taxes to the towns we know that have filed these liens. How much do they owe the state of Connecticut? I would like to know.
It's good to know. That would be very, very good. And that's why the transparency is so important. And that is one of the things that we're hopefully going to be able to find out. Now, that might be something that we'll be able to find out through Connecticut tax law, but I'm not sure about the federal tax law.
Right. It's really hard to find the information that we need to make the decisions. And so, they come in, they do this, and then we're left with, the mess. And there hasn't been the urgency with the elderly that there is with other populations over the years. But I think that's the tide's changed. As you know, the governor's bill was on aging, the speaker's bill was on aging, so people are starting to take notice that.
I think that people, I think as a general rule, we've been hearing so much about how we're too hard on the big businesses in the state and how everybody's going to leave us. And we haven't really spent a lot of time thinking about the people who have needs, the people who are, in senior citizens in the nursing homes or needing home health care. I don't think that we've spent a lot of time on the population that has the needs.
And Connecticut has, I believe, still the 5th most aging population in the country.
Yes.
So we have to be ready for that. We have to have, the situation settled, people receiving the care. So we're hoping that this session we make a lot of leeway in putting those protections out. We also have to remember that everyone thinks that the state is fat in employees, but the truth is in 2017, I think was one of the big cuts, and there was one with Roland too, Malloy and Roland before him. So when you look at our investigative services and DPH and all these they're very short staffed. They really are. When you don't get a call immediately back, it's not because they're lazy. It's not because of bad reasons. It's because they have caseloads of 200 or 300 citizens. So it makes it really hard. So another thing in the speaker's bill that we're doing is trying to not fully, but make a big step towards funding the ombudsman program. Which, as you know, Susan, they go out and they inspect and they work with them to help them be better.
That's right, and I know that Ann, Representative Hughes, and I had a complex care subcommittee meeting. Was it last week, Ann? With the ombudsman, and she talked a lot about a lot of different issues that that she needs. About the addition of more people to help with oversight in the community care as well.
Right. We have 4 positions.
She talked about it because I don't think a lot of our public even know that we have a community ombudsman program that has oversight responsibility of, not only our nursing homes, but we expanded it last year to include, folks living out in the community in assisted living as well. And before that, there was really no recourse for complaints besides calling Department of Public Health.
Right.
And we need a more streamlined and resourced, that's what Jane is talking about, resourced office to go out and ensure that people's quality of care and safety is being prioritized. Not just that they're existing or surviving, but that their quality of care is, like you said earlier, this is Medicaid dollars that are largely funding these residences. They are the residents of elderly, whether they're needing nursing care, skilled care, assisted care. It is their homes, and we need to ensure that these dollars are going towards their quality of care and not just the profits of private equity firms.
Right, and one of the things that we've done over the last several years is we've moved people out of nursing homes and into the community. And so that's been a big problem too, because now we also have something called a nursing home standard of care, instead of just if you have a need to be in a place that provides you with, daily care and for your personal needs. Now they're being quite let's say judicious in their analysis, overly judicious, because they're saying, oh, well, you're not really in need of nursing home level of care, and people are left to try and manage on their own without the home care services.
So that's why the presumptive eligibility is really, really important. It's presuming that the person is eligible, because right now they go directly into nursing homes where they might be able to go home and with a few weeks of nursing help, etc., or physical therapy, they'll be back on their feet. So they get put into nursing homes, and then it's a deep slide down. And having said that, we want people to have choices, because I've met people that feel the nursing home is their home. They don't have any family left, any friends, they don't have a house, and they will tell me, this is my home and I'm doing well. But there's others, many others, that want to have in-home care or in a group home type setting for the elderly, which is much better than the other. One of the other in the governor's bill is to reduce and not allow 4 people to a room. Can you imagine 4 people to a room, like a hospital setting? Some of our nursing homes have that. It's being reduced to 2 max.
Well, I used to work in nursing homes after school when I was in high school, and we had a lot of 4 people to a room.
Right.
And but the other thing about that is there are a lot of people who I couldn't imagine them being in the community.
Right, but that's why there's a choice. We don't
Yes.
want to do away with nursing homes. We just want good nursing homes, and there are good ones.
Yeah.
We tend to talk about the ones that we have challenges with, but there are good nursing homes. There's good home care. There's good adult day centers. And we want all those choices to be available.
Yes, and so one of the things too is finding a nursing home bed in a particular area. Now here we seem to be having problems with that because we don't have as many nursing home beds. So when someone is being discharged from the hospital to a nursing facility, sometimes they can't be discharged.
At the same time, we have 2,000 beds not being used in nursing homes. I learned that today.
Mm-hmm.
2,000 beds that are empty. One of the situations we found, when you're being released from the hospital, they put out to all the nursing homes, if that's what you need.
In your region.
Right? But they don't, so the first one comes in, the hospital tells you, you're being released today. They don't give you a day's notice, whatever. So the first nursing home comes through, they'll go in and tell the patient, look, this is what's come through. So you don't have, even though 5 more may come in later that afternoon. So there has to be a way of streamlining that. So again, the person has it's important to be near family because they'll visit you more.
Well, that's why they want to do it in a region. And sometimes if you close all the nursing facilities down, or the state does have to pay for keeping the beds open, because if they don't, then they won't have any place to put the people when
Right.
when there's the need for a bed.
So it's not simple.
No, not in the least. And so it may sound like a lot, but those places may get filled up pretty quickly depending on what's going on in that particular community. And it's really important to make sure the beds are open and we have a place for people in a good nursing facility. Because sometimes, too, you run into a situation, I find here in this area, where people are in the nursing home because they have a overall really difficult condition. And maybe they're on Medicaid, but, they have an apartment and the state will pay for so long, and then they don't pay for any more, and then all of a sudden the nursing home wants to discharge them. Where do they go?
And that's why they have to notify the ombudsman on the same day. We passed this last year when they're releasing someone who's not ready or able to move out, Before they would just release them and the person was on their own.
But they didn't. They ended up in the shelter.
Right, right. Now they can't do
and
that.
And the home care agencies don't go into shelters.
Yeah, so it's hard.
Yes. So that was a real problem, and it still is a problem that we are looking at because I think it was a little bit too quick in terms of that situation. And I have had over the years numerous cases, not just as a representative, but as somebody who worked at the Legal Assistance to Medicare Patients Project and the Center for Medicare Advocacy, where people wouldn't go for the extension of time. Now, there was a time when I was able to get, when I was working for legal services, an extension of time through the State Department of Human Services. Are they still doing that?
I don't know. Ann, do you know?
I'm not sure, but that's this whole broad topic of again discharge planning, resources, as James says, a choice, but also having the staffing and care managers and resources on the state level to really oversee all this is what both of our priority bills are really highlighting the need for. I don't think the public even knows how much, how many folks fall through the cracks that don't have means for private home care or private skilled nursing care. So, and that's like 90% of all of us, right?
Well,
Medicare doesn't cover it. They cover just limited after discharge for a hospitalization, but even that can be really, really contentious. You might have to call the Center for Medicare Advocacy. You might have to call the Center for Healthcare Advocacy to fight that, because Medicare is trying to drop you from badly needed rehab stays.
Well,
I don't think the public is even aware of that until it happens to them or a family member, right, James?
Right.
Well, you make a good point, because what happened back in the 90s is they went from a fee-for-service plan to a capitated system for the home care agencies, which made it so the home care agencies would say, well, you've got a chronic condition, and we are only going to get so much money for your overall condition, because they've capitated that, and you're going to need it for the rest of your life. And so the agencies said, we just won't take you. So there's no place for someone to be discharged back into the community with ongoing services, unless, of course, it's a Medicaid-covered service. And so they'd have to get the coverage through the Medicaid program for the home care services, even though they might be eligible for Medicare. And, of course, Medicare, they only really need to have one skilled service in a 60-day period according to the regulations, but try and get that one through.
Right. But it's like Alzheimer's right now. In many of the nursing homes, you go in and they ask you 5 questions. Who's the president? When's your birthday? But you might have just spent 3 weeks in critical care in the hospital with seizures, the first time in your life, all these things going on, and it's your first day going into the nursing home. And then they declare you with Alzheimer's because they get paid more for an Alzheimer's diagnosis. And there is a bill in there requiring there are cognitive tests that they can do because then they treat you that way too. I've had a woman, they declared that Alzheimer's that she didn't know, and she kept hearing mice at night in her nursing home room. Now, I get mice. I put out traps, right? We all get mice. It's not that fact, but that they denied it, and they said it was because she wasn't of the right mind, and her son put out traps and caught mice.
Oh.
So, yeah.
Private equity, not getting rid of the mice, huh?
I mean, well, all you do is call the company, right, and have them come in and take care of your mice.
Yeah. Wow. That's almost worthy of a movie.
You're so funny.
Anyway, we're going to come to our break, and I can't thank Representative Hughes and Representative Garibay enough for being here for this great conversation on health care for seniors here in Connecticut. We'll be right back after these messages. Susan Johnson, and I'm here with our great guests this evening, State Representative Jane Garraby and State Representative Ann Hughes. We're all focused on health care for seniors and what we can do to make sure seniors and their families are living well in the community and addressing their medical needs as needed. So I can't thank them enough for being here today and talk about all the policies that we're not all, because we got many policies, right, ladies?
Yeah.
But talk about some of the policies that we want to see happen during this session. So, making sure that people are doing well is really what this is all about. And we just talked about the governor's bill and the speaker's bill about making sure that we're going to be analyzing how we're paying for these services and whether they're reaching enough people. And so maybe, did we cover that well enough, or do we need to say any more?
Just that, well, we were, when we were off for a little bit, we were talking about staffing and having enough nurses, CNAs. I think all this is blowing up now, and
Yes.
we're becoming aware. And I know our community colleges are working on programs for
Yes.
CNAs, for nursing, and all of that, which is really important. It used to be years ago, and there may still be some programs, but you could have work study in high school. In that last semester of us as a senior, you could work in a nursing home, get paid, but also train. And it was more than 2 weeks training. It was 6 months training. And those are the programs that we have to triage. That's what I keep saying, and people don't understand. And Matt Brockman was laughing at me because I said, we got to be like MASH. They didn't have hospitals. They didn't have equipment. And he goes, Jane, you're dating yourself. No one's going to know what MASH is. So I said to him, you do MASH. And he goes, I'm weird.
But yeah, we had the Candy Stripe
Right.
kids that would come into the
What about
hospital.
volunteers? They've kind of kept those out of nursing homes,
Yes.
really.
Yeah, but they had them in the hospitals, and I don't recall when I was working in the nursing home as a teenager whether or not they had. There were no volunteers, but they did have.
When I was in high school, I went and volunteered. We would do bingo with the residents, a different kind. It's
Oh
not
no, I
direct
actually
care.
provided the care.
Right.
I was actually doing the work, and I was there after school for a while and getting people ready, feeding them, getting ready for bed, and that kind of thing. And so I did that, and it was, but it was kind of like you didn't have to have any training for it either. But it worked out pretty well for me. I was kind of a natural. But,
Caregiver, you are.
But it was, and my mother did it, and my grandmother did it, and my great grandmother did it.
Wow.
My great grandmother actually opened up her home to seniors and took care of seniors in her area in Bangor.
So that's interesting.
Yeah.
In England, what they do is they partner college students with senior citizens that are alone.
Yep.
And it's just compact, and they're not a caregiver, they're a companion. They might help with dishes, with the lawn, but they get free room and board
Yep.
because they're in college, so it works out as a partnership. And that's the best situation when you have multi-generational together, not just all old people in one place.
Well, she had, I don't know how many people she had at once, but she had them
That's
all
awesome.
in her house, and that's
I can see you doing the same thing, Susan.
I'll have to talk
Yeah,
to Dennis.
we passed an essential caregivers Bill of Rights. Was it 2 years ago in Aging Committee, Jane? I'm not really sure, but we had some advocates testifying just on Thursday that they are pushing for Congress to adopt a similar essential caregivers Bill of Rights to allow essential caregivers. They could be family members, or they could be, neighbors or friends, to come and have access to their loved one and maybe help with feeding or, some of the personal care activities, which definitely supports the paid workforce, of course, but it's much more personal. And out of that bill also came our bill for empowering family councils for nursing homes, for families to meet as families about concerns within the nursing home, and that is supported by the state as well.
Yeah, those are all excellent points. And one thing that I kind of am thinking of as you're speaking is the fact that when we have families who have these needs, when we have provider family members or friend family members who kind of like are incorporated into our families, what we have is a sense of community. And it's kind of one of the things that we kind of lost over the last few years, is a couple of decades anyway, the sense of community. And I think that that is one of the things that might be another way of bringing back that sense of community. Your neighborhood, your family, your friends, so and so needs the help, the people pitch in.
In some of the nursing homes where my brother is, for example, which is a smaller nonprofit family owned nursing home, there's like 5 women who have either their mothers or their fathers in there. And they have this group and they watch out for each other. They walk by every day that they're there. There's someone always there. They're keeping track of the staffing ratios, etc. And they go in to visit my brother. If I go in and visit their mother. And it's that sense of community again, of taking care of each other.
Yeah, and I think that's a wonderful way to bring it back, and maybe even have more discussions about how to do it in different regions. And that might be something that we could take a look at and join up with home care agencies through maybe MAPOC, have a discussion about it, join up also with the nursing facilities and see how all these things could be coordinated more. I know the St. Joseph's Nursing Home Living Center here also includes hospice. So they have a section of the nursing facility that has a hospice. And I think that as we were discussing with Representative Hughes in the Complex Care Committee, how we might be able to take some of the nursing facilities with those beds that you're talking about and maybe give a rest home certification so that they'd have more flexibility in the kinds of patients that they take.
Right, and we also, with the homelessness
Well,
and
that's
the
what I'm talking
elderly,
about.
it's gone up 20% this past year.
Yeah,
The
yep.
homelessness.
For these seniors, and that's what Representative Hughes and I were talking about, how to address the homelessness for people who have these disabilities and so forth, and behavioral health issues. And the nursing facilities won't take people with behavioral health issues to any great degree. And so having them in the rest homes or these community rest homes that are a little bit different certification requirements would be another way to address some of the concerns about more empty beds, but also a way to get people housed and treated and cared for. Yeah. I think that was a good discussion, Ann, right?
Yeah, it was. And we also highlighted in our hearing on Thursday that because Connecticut enacted a moratorium on any new nursing home building facility, we have incredibly outdated facilities that haven't been updated and haven't been invested in. That's why we have 3 and 4 bed rooms, that shared rooms, and we don't have rooms that have dedicated air conditioning and heating, which is also something we looked at, throughout the pandemic and since then. But it's going to, but because of the moratorium, which maybe we should be looking at as well, we should be building or renovating, which is awfully costly, really a more modern version of how people want to live and have privacy and access online and all that kind of stuff as part of aging with dignity and aging with choice, as Representative Garibay was saying, in a home-like setting. And though the infrastructure and the investment in those capital facilities, like, the capital investments, the capital improvements, is going to take a lot of investment, because we have really aging 30, 40, 50-year-old facilities that people are still living in, and that is no longer acceptable.
Well, I had that same conversation in the Public Health Subcommittee in Public Health, and I asked her, what did we do with the ARPA money? And did we renovate the HVAC systems in our nursing homes? And I was told no, that wasn't part of what they were looking at. So it wasn't anything that had been done or had been considered during this whole situation where we know that HVAC systems, if they're not properly put together, can spread germs.
There were very few guidelines on that money, so we didn't see it go to the workers.
No.
We didn't see it go to the direct care. We didn't see it go there. So that's one of the questions we have is how was that ARPA fund spent? Which would be a very, I do have to say there are facilities doing it right, and I'm going to mention them by name. Live Well in Plantsville, which is a part of Southington. They are a nonprofit. They have nursing home, they have Alzheimer's care, they have a day center. It's one of those multi-use, which is the best. And they have renovated that building. That is someplace I wouldn't mind going. It's absolutely wonderful, state-of-the-art. In my district, we have a nursing home, Kimberly Hall, and what they've done is they made one whole wing a dialysis unit. And now first choice goes to those that are living there. So people that need that kind of service live at Kimberly Hall, because then you don't have to pay for transportation to Southern Connecticut or wherever that dialysis, or to the hospital. So it's people getting creative, and they are a for-profit. So there are some doing it well, and we have to look at those, and we have to appreciate them.
Oh, yes.
But that's another thing where they're going to do a dashboard. It was in the governor's bill. A dashboard, it's really a report card where it's real. It's not self-declaring, saying what you're doing, a real one. So I can look, and it has to be easy, like 5 stars. I know what that is.
Yes.
A, B, C, D, F, I know what that is. So it has to be clear. If I have to put my aging husband in a nursing home, it's usually in an emergency, a stroke or something, I can go on to a state website and look at it and be able to have an informed choice where he goes. So it's jam-packed full for nursing homes, for adult day centers. More we had for them last year. They still need a little help on transportation, but
well, the non-emergency transportation is always a problem, and of course going from the nursing facility, say, to the doctors and back has always been an issue. It's been made more cumbersome, I think, over the last few years with hiring these out-of-state corporations to address non-emergency transportation systems. And so that's something we'll be looking at again. They're going to have another contract negotiation, and we're going to have to take a look and see how we're going to manage that. The Department of Human Services, of course, does that. I think the commissioner is wonderful. I think she really understands so much and does so much. So I have ideas about that, but we'll go on to the next subject.
I mean, we could talk here for hours, Susan.
we could.
And Ann.
But let's move on to another good issue.
I appreciate the overlap of Human Services, the Medicaid and Medicare Standing Oversight Council, and the Aging Committee. We were really highlighting. Jane's co-chair, Mitch Belinsky, nominated our committee for world peace.
The Aging Committee.
That's diverse, I'll have to say. And public health also is part of this as well.
Yes,
when I was chair of public health, because public health has a huge hand in how we deal with our facilities and how we manage, a lot of the, regulations for home care, health, for nursing facilities, for rest homes, for all of the things that hospitals. All these things are interesting and very, very intertwined with the Aging Committee, with the Human Services Committee. And so sometimes I often thought it would be nice to have all the payers of health care under one committee, just to have an analysis of how the payment system works. So
yeah, they seem to work really well together. I watched Commissioner Gittani with Commissioner Barton Reeves, Amy Porter. So I'm seeing a more connection between them, which is good, just as there is between House members. But housing is important. Planning and development is important. GAE, all these committees are super important. Insurance.
Oh, yes.
And, I mean, it's
Well-
important that we all come together.
That's right. Well, all the intertwining, I was just thinking about more immediate
Right.
intertwining of public health, DSS, and
The ones we work with most.
Yeah, but of course you mentioned housing, and of course that is one of the things that Representative Hughes and I discussed, and how we talked and learned some things about how rest homes slash community homes with a little bit higher certification could actually address some of the housing issues, and I think we just mentioned that before, but we could address some of the housing issues for seniors who don't have a home anymore and have just come out of, or need to come out of the nursing home, but there's no place for them to go, and we really shouldn't be discharging them to shelters and medical conditions.
Or leaving them in nursing homes and paying, $10,000 a month or whatever it is.
Yeah.
And I just want to say, because I had someone the other day that was very upset. They're in the nursing home. They won't make it out.
Right.
And they were talking about how the state took all their money. And because they had to do a spend down,
Right.
And I said, but what you're doing is paying rent in a certain way for your care. You're not giving the state money. This is you paying for your care. And there may come a point where those funds are gone and we're still going to take care of you,
Right. That's such a good point, and that's something that we really some people misunderstand. And no, the state doesn't get the money. It goes to the facility that's feeding you, giving you medical services, making sure that everything's working well, making sure if you have a complaint you can go to the ombudsman, making sure if your family is helping oversee the situation that they can also go to the ombudsman. So there's there's all kinds of things that does that money pays for. And it is something that's very, very important. And I have to share just quickly, when I went to Canada, I thought, everybody says everything's taken care of there, but not long-term care. Long-term care is not cared. People spend down their money in Canada too for long-term care services.
I think almost because in Spain they do too. They have
Yeah.
excellent elderly care.
Mhm.
They have public health options. It's a public health.
Mhm.
But they also, that's what you work for, so you can be taken care of.
I got to say thank you so much to Representative Hughes and Representative Garibay. Any last 10-second words?
Just thank you for bringing us together to talk about something that I know both Ann and I and you are passionate about.
Absolutely, Ann.
Yeah, we're really pleased to have this opportunity to amplify to the public that there are some transformative proposals going through the legislature right now that really makes, I believe, historic investments and prioritizes quality of care and needs of residents based on their needs, regardless of ability to pay and zip code. So I really want to applaud the governor and our leadership
Great.
in helping make this a priority for this short session.
Well, thank you so much, both of you, and we're going to have you back. And everybody, hope you come and listen to Let's Talk About It again next Friday at 5, and have a great week.